Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. I'd like to tell you all that we're very, very grateful that there were more than 500 hits last week on the Omicron variant of the COVID. So please do continue to watch these most important talks by Dr. Pachegaonkar. Today we are going to talk about autism.
Autism, like any other disorder, especially in children, is diagnosed even before the age of 3. It can be diagnosed with observant parents and pediatricians. It's mainly a functional disorder. You don't have any structural change or anything. It's a functional disorder where it is the reactivity of the child to the environment or to the surrounding which is studied, and based on that what we call autism spectrum disorder, where there are behavioral problems among children, especially in negotiating with the social structure. And these autistic children, they just are into their comfort zone. They don't want to leave their comfort zone. They like some activities and they stick to those activities, and repeatedly they take interest only in that. So in some areas they take utmost interest, and for hours together they can work in that, and whereas the area which doesn't interest, they hardly can concentrate it, they don't work in that. So repeatedly, like for example, if the child likes one item in vegetable or food, they would always long for that. Not only that food, but they may even stick to get attached to one restaurant where that item is available. They don't want change. They are like monotonous activities and they are happy in their comfort zone. Whereas in normal children, they would have inquisitiveness, they wouldn't mind changing the taste or having different varieties of food and relishing them. But these children, they are stuck in that.
What about the arts?
Yes, it comes to that. In certain, see, like they if they have that aptitude and they develop it, they would be totally into that. I have seen one boy who was very good in drawing and painting, and excellent performance in that. But regarding other studies in other subjects, he used to be just nil. And he used to appear his matriculation examination in the board. He used to be scoring the first rank in drawing and painting, whereas he used to fail in all other subjects. So he never could get any prize for that, because failed students, they don't give rank. Rank is always among past students, and he could never complete his matriculation. But he is excellent, fine artist, very popular. So these are all the examples of autism. Some people find it odd, but for them, if they are into their comfort zone in their area, they perform very well. Somehow it should not be confused with mental retardation. Their IQ level is quite high. Only the problem is that they want to work only in their comfort zone. They don't want to compromise for the society and take interest in something which is imposed upon them. So if anything is imposed, their behavior changes. Then they behave abnormally if things are imposed upon them. But if they are given freedom to flourish, they are given like motivation to flourish in their comfort zone, their performance would be excellent. They will be performing much better. I have seen some children, they are very good in mathematics. They perform very well, whereas even average other student can't perform. But whereas in other cases where other subjects, if they don't have interest, they will take no interest at all. It can't be imposed. No good teacher also can convince them to take interest in this subject.
What about the parents?
See, parents, if they are wise, they will be able to recognize it at quite early age, even up to the age of 3. They can, like some certain toys, the child is fond of only certain toys and not other toys, even varieties. That means definitely the child is autistic. If child is too much attached to one type of toy or one toy only. So even at early age, before 3 also, we can identify the child to be like that. And then the art is that at this age you should not give negative response to their activities. Like instead of telling you don't do this, why did you do this, instead of telling, you can encourage what are positive things. Like if child is doing something, oh wonderful, you could do is, we couldn't imagine, but can you try this, that way you can suggest. But things should not be imposed upon them, otherwise they go in suppression. And we have seen some children, they even don't bother about having contacts with the people. They avoid eye to eye contact while talking if the things are not of their interest. But if something is there which interests them, then they will take utmost interest.
And even eye to eye contact.
Yes, even eye to eye contact. If they are, that's what I said, the comfort zone. If they are in comfort zone, they are fine. They will talk. If the subject, suppose for the matter, like some subject which they like, they will perform best even in presentation also. But if the subject is which they don't like, even you ask them to read what is written about the topic, they won't be able to take it. They won't even sustain reading about that topic if it doesn't interest them. So such is the behavior. Actually, some of the child psychologists, they say autism is not a disorder at all. It is a sort of a mismanagement of the aptitude of the child. So many parents and trainers are responsible for the autistic behavior of the child. If you are not able to provide a suitable environment depending upon which suits the aptitude of the child, then the conflicts come, and out of conflicts again there would be a performance will be affected of the child.
How has the medical community handled autism in the past and present?
See, these things are not to be medically treated. Means the autistic children don't need any medicine.
But they did this, no?
They used to. They used to confuse this autistic phenomena with ADHD, where that attention deficit hyperactivity syndrome, where the child goes on repeating. For example, ADHD child, if is hyperactive, will go on talking same things even whether it carries any sense or not. Anything, the child will go on talking. What we call idiotic boldness is there. Whereas autistic children are not like that. If the child has interest in that topic, and if the child knows the topic, child will perfectly present the topic aptly and very efficiently. Whereas
Even to an audience?
even to an audience, we have seen some children who have aptitude for singing music. They perform very well at very tender age. You must have seen some children going for even classical singing at the age of 4 5. It's not only training, it is their aptitude, it is their comfort zone, and these things can't be imposed. And we have seen our one homeopaths team is working in Bombay on autistic children, and they found that these autistic children develop such a sixth sense sometimes, where they get extrasensory perceptions. And they conducted this experiment. One child, they used to just write one number on the paper and just keep it on the table, and child from distance would tell what number you have written, even without looking at it. So these children are capable of even developing these sorts of faculties. They get even what we call clairvoyant visions. So they are well developed. They are not to be confused with mentally retarded children or even ADHD children.
How do they progress as they age?
Same thing continues. Same thing continues in the sense that sort, like much depends upon environment. Like if the person is given the opportunity in the area which interests the person, he will be excelling in performance. I think once in discussion I have given the example of one mechanic who he couldn't graduate, but his performance is the best in the field. So similarly, there are people who get proper environment, proper motivation, proper opportunity. Definitely, they excel in performance.
Now, into their 30s and 40s, they'll be the same?
Yes, yes. Aptitude wise, they
There
will
won't
be
be
just same.
change. There
Yes,
won't be any
yes,
change.
yes.
I see.
See, that's what I said. These are all the what we call depending upon the environment. If there is antagonistic environment, they're all faculties will be suppressed. They will be suppressed, and they will be really difficult persons to manage. Whereas if they are getting opportunity, a proper conducive environment for their areas which they have aptitude in, definitely they will flourish, and they will definitely perform very well. They will be genius in that field. I have seen a case where father at the younger age only, father used to impose the particular curriculum on the child, and child used to say that I am not interested in this. The child would say, no, you need to be engineer, because in society engineers are needed. I am talking of something around 35 years back. And this person couldn't complete his pre-professional for admission, which is a prerequisite for engineering admission, and somehow with average marks he passed. But his father was very influential in the society. He managed to get admitted in engineering college with lot of capitation fees and all, and somehow the person couldn't complete education. He couldn't complete his graduation, and after 8 years of failure, this case was brought to me for treatment. And when the whole case I took from the beginning, otherwise IQ wise the boy, grown up boy, now he was like a 26, 28 years grown up adult, and he was perfectly normal. But the all impositions and suppressions and contradicting attitudes of parents ruined his career, and then he went into depression. They can't take it. You see, if they are in comfort zone, they perform very well, and this became a problem for the whole family. And somehow at that age also, when I convinced parents, I told that you too, parents, need the treatment. I need to rehabilitate you in bringing up children, and now and really it worked. They allowed him that we are friendly, you don't worry about earning, we will help, but what you want to do, you do it. And then he said, I will go for farming, and farming the dairy unit, and helped him. He got married, he has children, he is a grown up person now, and very good performance. Whereas his father had a dream that my son should be engineer, you couldn't take it. And 8 years he lost in conflict. The mother went in depression by witnessing the conflict between father and son, and then the family was brought to me.
And so when the boy went into depression, it was difficult or not so difficult to get him out of it once you taught the parents?
Like I talked to parents so that maintaining cause for his depression was eradicated. Means like they stopped imposing things upon him. They said, fine, like whatever you want to do, you do. You don't worry about your career or earning or anything. We are there to support you. And this motivation helped him. He started taking interest in farm, he started taking interest in dairy, he started interacting with the people in that field efficiently. Whereas with engineering teachers who were very much eager to help him in learning engineering, he couldn't take it. Whereas he worked very well with the people who are in dairy unit and agriculture, and he became successful, and within 7 8 years he established himself in that field. So it's like even in grown up, but their basic aptitudes are same. And why do you need to change it when it is not abnormal? You see, someone having aptitude for certain thing, interest in certain thing, which is not antagonistic to society. What is the problem? So if you complement the aptitude and give opportunity and don't demotivate, that's what we say. We should always react positively to things. Like if there are something which are wrong, hazardous to the society or harmful to the society, we can definitely suggest them that this is something which is not good in society. Then they may take it. Like they will find out something else. So yes, in music and all, we have seen all these autistic people. If they come into their comfort zone, or like say music or even instrumental or classical singing and all, and if the environment also is not contradicting them, they flourish like anything. They flourish. We have seen, see, these autistic. I have another example. There was a very popular fine artist, a painter from Mumbai, very popular, internationally popular. You must have heard his name, Almalkar. Almalkar. I'm talking of old days. See, his story is like that. He went to his parents, family said, if you want to learn painting, you can pursue it, and you can choose your teacher, mentor. He said, in north there is a paint artist who is a very good coach in this. So as a gurukul, like, he went to him, and it was a traditional art house. So he said, okay, we accept you as disciple, and he was asked to give duty at the door of the studio. And for 3 years he was not allowed to be in the studio. He was allowed to clean it and sit outside at the entrance for 3 years. And many students, they came, they worked, they learned, they started making presentations, and they were feeling sorry for this person. And at the end of 3 years, the teacher told that, Almalkar, your training is over, you can leave. The other students who were contemporary children, they got worried that how come this young person has come here for 3 years and no training was given to him, and now our teacher is telling your training is over. And this person also very happily, nicely accepted it, had pranam, and was ready to leave. When these other students, they went to teacher and told, this is injustice. The person has come here 3 years to learn work here, and he is not given 1 minute of training in studio. Then he said, you won't understand what he has got. And this is that fine artist, from Bombay, who became internationally acclaimed artist.
Incredible.
And how I came to know about this story, these are all autistic. And how I came to know is, from our place, there was one Bhaskarrao Jirai, a very popular painter, fine artist from. So I asked him, how did you learn painting? Then he said, see, my parents were imposing me. My brother is a veterinary graduate. Sister is so much educated, but I had no interest in learning this. And my parents are not allowing me to undertake this drawing and painting. They don't like it. So he just ran away from home. He just absconded and went to Bombay, and he went to this JJ School of Fine Arts. It's a government school, very popular school in Bombay. He went there and he went to the principal that I want to learn painting. And then he said, you are not even matriculate. Our minimum qualification, we can't give you admission because you are not qualified. But he said, I want to learn it. I can't complete matriculation in my life. I can't do it. And then they told that we have an alternative, that we call one person who is not qualified himself, but he is very acclaimed, popular fine artist, Dr. this Almalkar, and he comes as a faculty member to us. And you just, if you approach him, he will take you. And then he approached him and he said, come. And he learned, and he was very popular artist. He passed away at the age of 72, 73 recently. Very popular artist. Very popular artist. But whereas if you see schooling and all, nil. This Hahnemann's portrait. Our Hahnemann is our founder in homeopathy. So his picture I wanted, a portrait, and he did it. When I told him, I was after him for 4 years, but he said, I have no time. And one Deepavali day he came with this painting, and doctor, I could do it. I got the mood, and in 1 week I completed it. And this portrait, now also this portrait, all over the world, people ask me like, how could you get this type of painting? Such a, attractive, influential, influence it gives, wonderful. So these autistic people, if they get opportunity, they can flourish at up to age, but they will be just like that. They will be just like that. They won't change.
Then you recommend to the parents not to take him to a doctor.
Take to counselor, and parents need counseling. Parents should go to counselor first, not the child first. And then parents should learn how to, allow this child to flourish. And definitely they will be excelling in their performance.
Speaking in the terms of yoga, how is this entering into the child?
You see, we don't know, like these are like karmic bonds of past life, and how these, it's not a genetical thing from only these parents, but we don't know like from how many generations these genes are transmitted, and they become active in this. That's difficult to explain, but there are children with family history of autism. There are geniuses. Yes. The series, like we have seen many people, at least one child in the family will have that. So it may not be the same parents, but it will be among siblings, someone. But definitely there is a great role of something in the past.
This is very, very interesting. Thank you so much, sir. Namaste.